this year. I would like to introduce our co-members of the subcommittee on education and health professions. And we will start with Senator Head to my left.
Thank you, Madam Chair. I'm Senator Chris Head, representing the 3rd District, which is the northern half of Roanoke County, Botetourt, Craig, Allegheny, Rockbridge, Augusta, Stanton, Waynesboro, Buena Vista, Lexington, and technically Bedford. I determined that I have actually one house in Bedford County. So,
Thank you so much. Senator Locke is not on the dais, but we will. Aren't you in this committee? No. Sorry. We just ran down together. I apologize. Senator Pekarsky, it is still early in the morning and I haven't had all my tea.
Good morning, everyone. Happy Friday. Stella Pekarsky. I'm representing Western Fairfax County, which is Senate District 36.
Great. And our Senator Bagby and Senator Pillion are not with us yet, but they are also on the committee. I'd also like to introduce our staff today. We have Julia and Kate from DLS. If you all would just like to. Yeah, that'd be great.
Good morning, Julia Carlton with the Division of Legislative Services.
Julia Bergamini with Division of Legislative Services.
And Hannah Yates with the Division of Legislative Services.
And then we have Hobie, who is our clerk, and Madison from the clerk's office, if y'all want to say hi.
Good morning, Hobie Lehman with the Senate Clerk's Office.
Good morning, Madison O'Dallo with the Senate Clerk's Office.
So that is our team who will be staffing us through the session. Today we have possibly 4 bills, but definitely 3. And Senator Locke with SB 35 is first on the docket. If you'd like to join us. Do you have people who will be testifying as well? I just want to make sure that we have enough time for.
Yes, ma'am.
Okay. We'll do 5 minutes of testimony total for everybody. Thank you.
Thank you, Madam Chair and members of the subcommittee. Senate Bill 35 directs the Board of Medicine and the Board of Nursing to require completion of training on unconscious bias and cultural competency as part of their continuing education and continuing competency requirements for licensure. And I have been trying to get this done for quite some time now. The background to this has to do with U.S. maternal mortality rate as it particularly relates to African American women and babies. The U.S. maternal mortality rate exceeds that in other high-income countries, and the gap is worsening. The rate is exceptionally high for Black women. According to the most recent Virginia Maternal Mortality Review Team triennial report, Virginia's maternal mortality rate, pregnancy-associated deaths, more than doubled between 2018 and 2020, from 37.1 deaths to 86.6 deaths per 100,000, and Black women continue to experience higher rates of pregnancy-associated deaths compared to their white counterparts. The pregnancy-associated death rate for Black women in Virginia is almost 2.5 times that of white women, according to the March of Dimes. In Virginia, Black infants are dying before their first birthday at a rate almost 2 times that of other babies. According to the research from the National Bureaus of Economic Research and others, higher income and education are not protective factors for Black mothers. In fact, UVA professor Neo Hajawara and painter Davidio and Smetley, in their recent book, Unequal Health, Anti-Black Racism and the Threat to America's Health, finds that the infant mortality among Black mothers with a college degree was greater than among white mothers who did not finish high school. Increasing evidence indicates that racism across multiple levels of the U.S. health system is a key cause of these disparities and maternal mortality. Unconscious bias, sometimes called implicit bias, is a bias that is present but not consciously held or recognized. Numerous professional medical and nursing organizations acknowledge unconscious bias and urge their members to take action. Other states, including Michigan and Minnesota, have required unconscious bias training for healthcare professionals as a step towards ending racial disparities in maternal mortality. So it is time for Virginia to do the same.
Thank you very much. Are there questions of the patron from the members before we start testimony? Senator Head.
Yeah, Madam Chair, not a question, but just a comment that I am so glad that we're finally going to get this one through, because Senator Locke and I both carried the bill last year, I in the House, and she's been working on this far longer than I'm a Johnny-come-lately to this issue, but I am so thrilled and thankful that she's allowing me to be a co-patron on this legislation. This is important, and I'm,
Chief co-patron, Senator Head.
yes, ma'am. And I am. This is important for us to get done, because the data is shocking when you really study it, and if you care about people, we got to do this. So thank you for bringing this again. Is this the third or fourth or fifth time?
I can't even remember, but it's been several
It's been
years.
enough. I know for me it's the third time. So from my perspective, third time's the charm. You've been a lot more resilient with this, and I'm just thankful for keeping at it. But that's kind of your style anyway. So thank you.
Thank you, Senator Head. Are there comments or questions? Yes, Senator Pekarsky.
Yeah, thank you, Senator Locke. I just want to say thank you for your work on this, for your advocacy. This will save lives. It is critically important, and I'm glad that hopefully today we will have a positive outcome.
Thank you. I will just add my voice to that. Last summer, Senator Locke and I had a meeting with the Medical Society, and it is just so important that we are addressing this issue. You see stories in the news every single day, so I thank you for bringing this up and being persistent, because sometimes that's what we have to do, is bring something over and over and over again, finally, to work it out. Are there members in the audience who wish to testify in favor of the bill? And again, the limit will be 5 minutes total for both sides.
So that means I'll speak fast.
Thank you.
Good morning. Thank you, Senator Boysko, Chair, and committee members. I'm Catherine Haynes with the Virginia Interfaith Center for Public Policy. We would also like to thank Senator Locke and Senator Chris Head for bringing forth this very important bill. Virginia's maternal mortality rate, as you've heard, doubled between 2018 and 2020, 37.1 deaths to 86.6 deaths per 100,000. In Virginia, Black women experience higher rates of pregnancy-associated deaths compared to their white counterparts, and Black infants are dying before their first birthday at a rate almost double the rate of other babies. Race is not a protective factor. Infant mortality among Black mothers with a college degree is higher than among white mothers who did not finish high school. High-quality care is integral to improving maternal and infant mortality. Unconscious bias is directly correlated with lower quality of care. Virginia's rural maternity care deserts, as Senator Head understands, compound the problem. This bill makes evidence-based unconscious bias and cultural competency training a criterion for licensure for all healthcare professionals licensed by the Board of Medicine and the Board of Nursing. It has long been identified as a factor contributing to lower healthcare quality for Black Americans, recognized by the Institute of Medicine report and many others. I would like to thank PUSH Coalition members, which include those which will follow me, and also Urban Baby Beginnings, the American Association of University Women Southeast District, Virginia American College of Nurse Midwives, Burke United Methodist Church, the Eastern Virginia Association of the Southern Conference of the United Church of Christ, the Virginia Synod of the Evangelical Lutheran Church in America, the National Women's Political Caucus, Carried to Full Term, League of Women Voters, Birth Sisters of Charlottesville, Postpartum Support Virginia, Academic University, Unitarian Universalist Church, Luna Midwifery, March of Dimes, New River Valley Unitarian Universalist Congregation, NACPM, New Virginia Majority, who have all worked together on this bill. And finally, I asked my new intern, who asked specifically to work with me on this bill, what motivated her. She replied that as a Black woman who would one day have kids, she was afraid because the mortality rate for Black mothers was so high. This is the United States. As a former midwife, I understand that you would fear the pain of childbirth, but to fear for your life, this is unconscionable. We call on you to pass this bill, and I'm grateful for what I hear as incredible support from our leaders, so thank you.
Thank you so much. 2 minutes and 30 seconds left.
Good morning. My name is Galina Varchena, and I'm the Policy Director for Birth in Color RVA. We are a doula collective of over 100 doulas across the Commonwealth, echoing all of the points that were already made. And for the interest of time, I will just make one tiny more. The NIH, in a recent study, has found that health professionals are less likely to identify pain in Black faces, which translates to them ignoring the pain of Black people and Black mothers, and then not treating that pain appropriately. So when we talk about unconscious bias, that's what we're talking about. So I sincerely hope, and thank you again for Senator Head, and thank you so much for Senator Locke for leading this fight, that this bill finally passes. Thank you.
Thank you so much. Again, we're running out of...
Good morning, Madam Chair. Emily Moore with Voices for Virginia's Children. We strongly support the bill and thank the patrons.
Good morning, Madam Chair, members of the subcommittee. Freddie Mejia at the Commonwealth Institute, and we support the bill, and we ask that you do too. Thank you.
Thank you.
Brittany Willey on behalf of the American College of Nurse Midwives, and we support the bill.
Thank you so much. Are there members of the audience who wish to oppose the bill? This is beautiful. It seems that we have peace in the valley. So in a subcommittee, we do not, we make a recommendation as opposed to taking a vote, and it will be a voice vote. Do I have a motion on the floor? And second? All righty, all in favor, vote aye. Aye. All opposed? Hearing none. The recommendation is to support the bill and move it on to committee. The next bill that we have in front of us is with Senator Durant. It's SB 74. Senator Durant, welcome. This is your first bill in the Senate, isn't it?
It is. I feel like a big girl. So
you are. Welcome.
Thank you.
I hope you enjoy it. If you would like to tell us about your bill, thank you.
Thank you so much, Madam Chair, members of the committee. Senate Bill 74 authorizes the release of records to drug court administrators. Currently, the Code of Virginia already provides for probation or parole officers and a local community-based probation officer to have access to the prescription monitoring program relevant to a specific investigation. This bill would extend to drug court administrators and behavioral health docket administrators in Virginia. So I have with me today Ann Baker, who is the specialty dockets coordinator, here to kind of go in a little bit more depth. She is the specialty dockets for both the veteran and behavioral dockets in the region for Spotsylvania, Fredericksburg, Stafford, so that area, as well as Jason Chase, who is currently a drug court administrator for both the adult and juvenile services. I think just a couple of points that are important to note is that the fiscal responsibility, the training costs is on the agency, as it is already currently for those who are already authorized to be certified by the NADDI through the state police at the annual drug diversion school. And this will affect about 60 administrators through the specialty dockets throughout the Commonwealth. So the way that they can get into a little bit more, but the drug administrators already have access to this information, but what it will do, instead of having to kind of go through a laborious process to have to kind of chase down this information, it will streamline this for them so that they can get that access in a more efficient process and, really tackling this ongoing opiate crisis and overdose epidemic by limited ability of persons to be able to doctor shop. So they can certainly do a much better job explaining why this is really helpful for them. So appreciate the committee's willingness to listen.
Absolutely. Are there members of the subcommittee who have questions for the patron? Mm-hmm. No? Okay. Did you bring any witnesses who would like to testify?
Yes, ma'am, Madam Chair.
Excellent. Thank you. We'll have 5 minutes total.
Yes, ma'am.
For each side. Yes, ma'am.
Good morning. Thank you, Senator Boysko, and your committee for hearing on this issue today. And thank you to Senator Durant for bringing this forward. Again, like Senator Durant mentioned, first, I'm Ann Baker. I'm a specialty docket coordinator for Spotsylvania, Stafford, Fredericksburg, and King George And with me,
I'm Jason Chase. I'm the drug court administrator for the same jurisdiction.
and drug courts and behavioral health dockets are criminal justice and treatment dockets. So this would help administrators like us, 60 about so across Virginia, to have streamlined access to prescription information for the participants in our docket. Right now, probation officers already have that access, but sometimes we find that because the certification school is required training, that there's some turnover with probation officers, and we don't always have access to that information as coordinators of these specialty dockets. So that's why it would be important for the coordinators of the dockets to be able to have access and be included as well. Although we do have the ability to have release of information for all of our participants, a HIPAA release, this just makes it streamlined so that we don't have to make 10 phone calls to CVS. It would give us the access to the database. Jason?
I just wanted to add on some of our points here. The special docket administrators are aware of the importance to protect health information and remain in compliance with HIPAA requirements. The training that we end up going through with NADDI, the National Association of Drug Diversion Investigators, hammers that down into us as well as to who's supposed to have access during this stuff. Or during the information. A majority of the specialty dockets fall under the same leadership as defined in the code. In my particular case, my director authorizes the probation officers to have access to it as well. The Virginia State Police, they provide this certification and ensure that those having access to PMP follow the directives from the state. Giving access to the PMP and drug court administrators and behavioral health docket administrators in Virginia will enable to provide them a better treatment and supervision services to participants in these programs and streamline the access.
I also want to add, this is a harm reduction tool. Most of our participants struggle with substance use disorder, and so this is a very helpful harm reduction tool so that we have less opiate overdoses in our programs and fewer opiate problems from overuse of opiates. I did want to mention that VCCJA is also here in support of the bill, and so is the Virginia Association of Commonwealth Attorneys.
If you would like to come up and speak, certainly welcome to have you.
Madam Chair, members of the subcommittee, good morning. My name is Derek Davis. I'm Commonwealth's attorney for Surrey County, but I'm here this morning on behalf of the Virginia Association of Commonwealth Attorneys. We support this bill for the reasons stated earlier. It's going to make our behavioral health dockets and our drug courts more effective and more efficient. For those reasons, we support it.
Thank you so much.
Good morning, Madam Chair. Elizabeth Parker with Trauma and Pepper Strategies on behalf of the Virginia Community Criminal Justice Association, or VCCJA as stated. We're an association of local probation, community corrections, and pretrial service officers across the Commonwealth, and we support the bill.
Thank you so much. Is there anyone here who opposes the bill? Okay, hearing none. Other questions or comments from members? All righty, second. All righty, all in favor? Aye. All righty, recommend to report to the full committee. Thank you so much.
Thank you very much, Madam Chair.
Thank you. Congratulations.
Thank you.
I did not announce that SB 331, patron is Senator Stewart. He has asked that go by for the week. So I apologize for not saying that. And we are still waiting. Senator Head, how are you on your two bills?
Well, one, we're ready to go, and
Okay.
do you want me to go down, or would you want to present
You
from
can,
here?
whatever your preference is, sir.
Well, if it's all right, we'll just stay here. And if let's take up the 133
Yes, sir.
first, if we could. So Senate Bill 133 deals with practice agreements for physicians' assistants. And right now, all physicians' assistants are required to practice under a practice agreement, even if they are working in a hospital or on a patient care team. And the difficulty that you have with that is that you end up sort of duplicating the effort. They're having to be under a practice agreement with a physicians group, and then also under the practice the team in the hospital. And this just simply removes the requirement that if they are working in that situation, as long as everything is in place the same as it would be under a practice agreement, that they wouldn't have to be operating under a practice agreement to practice as PAs. So pretty straightforward. I think there's some folks here that would like to speak about that.
All righty, are there questions for the patron before we have the testimony? Okay, if there are people in the audience who are here to testify in favor of it, we'll do 5 minutes total for and against, if needed.
Good morning, Madam Chair and members of the subcommittee. My name is Bobby Cockrum. Thank you, Senator Head, for being a patron for this bill. I'm coming from Northern Virginia, representing the Virginia Academy of Physician Assistants, and also bringing experience as the system director for Inova Health System, where I lead approximately 1,500 advanced practice providers across the system. Inova Health System is one of the largest health systems in the state of Virginia, and also had sent a letter of support actually for this bill as well yesterday. I just want to bring the experience and explain a little bit about the bill and sort of reiterate the duplicity that this practice agreement actually creates, and it creates a huge administrative burden for hospital systems. We go through a process when you're employed by the hospital system or a facility of privileging, and which establishes how you are able to practice as a physician assistant as part of the care team. And this document, as the practice agreement is currently required, duplicates that process, makes it very hard to keep up to date. These documents are often incorrect. They're often very incomplete. Each time a physician comes and goes from the facility, they have to be updated, and the burden really falls on either the hospital or the individuals that the practice agreement involves, and it's very difficult to keep up. I spend an incredible amount of time in my position making sure that these practice agreements are kept up, and they really do absolutely nothing to define practice for the physician assistants in the hospitals. It's the delineation of privileges that the hospital systems use to establish what you're able to do and how you're able to practice. And it also establishes that relationship with the physician on the care team. So I would hope that you would support this bill. It would help tremendously with reducing that administrative burden for our hospital system. So thank you very much for hearing it.
Thank you so much. Are there other members of the audience in support of the bill? Okay, seeing none. Are there members of the audience who are in opposition of the bill? All righty. Seems like we've got quite a good second. You want to second it? Okay. And all in favor of reporting the bill favorably to the full committee? Aye. All right. Anyone opposed? All right. Hearing none, we recommend that we report it favorably to the committee as well. Ms. Senator Head, do you want to do the next one?
Yes, Madam Chair. Here's what we will need to do on this, and if it's okay with you, and I'll need your indulgence on this if it is, There are going to be a couple of technical amendments, one that we have in hand, one that we don't have yet in hand, but it is technical in nature only, and we could facilitate that in full committee with an amendment in the nature of a substitute. And if that's okay, knowing that we're going to go there, conceptually everything is going to remain exactly the same, and if that's the case, we can go ahead and move this forward. So that being said, then Senate Bill 155 is working with the Virginia Health Workforce Development Authority. Workforce development, particularly in healthcare, is something that is such a critical need, and this seeks to streamline the process and knock out a lot of things in sort of an omnibus fashion here to facilitate getting it done quicker. You've got the addition of 4 additional ex officio members to the authority, direct some changes to regulations regarding qualifications for nursing faculty and qualified mental health professions. Just to illustrate that, we've got barriers right now that there are credentialing requirements that if you don't hold the appropriate degrees on certain levels, even though you might have years of experience in the field, you can't work and teach in some of those areas. And that's getting enough faculty to be able to train additional nurses has been a real problem. And so that's an additional piece of this. It does establish a work group to address the healthcare workforce shortage, creates a program for health workforce development, and directs the Board of Nursing and the Board of Counseling to adopt emergency regulations to implement the relevant provisions of the bill so that the work group is able to submit its report to the governor and the relevant committees by October 1st of 2025. This will really help move the stones. We've got a lot of people that have worked on this on both sides of the aisle, and just honored to be able to carry it. But that is, in essence, the bill. Pretty straightforward. And again, the only thing that we'll be bringing is some few technical changes. So.
Thank you, Senator Head. Are there comments or questions for the patron at this point? Did you bring witnesses who would like to testify?
I don't believe so, Madam Chair.
Okay. Neither on either side. So I think this is a very important thing. We know that we are in really a crisis of having providers around the state, and I think it's a good concept. Is there a motion on the floor?
So moved.
All righty. All in favor? Aye. All righty. We will report it unanimously to go, to recommend reporting it to the committee. And with that, I believe we are done with our work today. Thank you so much. Okay.
The Senate of Virginia, Richmond, Virginia.